Hello, I'm Patzkowsky. Most of you guys know me, but for everybody who doesn't know me, I am an EMT. I've been an EMT since 2012, and I've also been CPR certified since my freshman year of high school. So I'm giving this speech. This is my dummy Bob. I'm giving this speech because it's very important to know how to do Heimlich and CPR as far as on an adult and on infants and children, and some people will forget. Some people, the biggest reason why people don't do it out in public and in serious situations is they're worried about doing it wrong, and wrong CPR is going to be better than no CPR. So if you get it, if you learn how to do it from my demonstration, you should be more confident in your future if you have any life experiences that have to do with, death or somebody chokes or whatever. The first thing I'm going to go over is CPR. So basically, you got to think of if you're alone if you're with your wife at your house or your husband, and they randomly get the signs of that they're pulseless. They're turning blue. They're no breathing. If you know how to find a pulse, which is if you want to find the carotid, you're going to follow the jawline down and go in a little bit, and there's your carotid pulse. If they don't have a carotid pulse, if they don't have a radial pulse, which is the pulse in the wrist, more than likely they need CPR. There could be some signs beforehand with men. A lot of women are asymptomatic, so that means that they generally don't have any symptoms to start out with. So basically, you have your wife or your husband passes out. What do you do? So first thing you're going to do is you're going to tap and shout, "Are you okay?" They don't answer, you're going to call 911. Alright? I recommend getting your phone and putting it on speaker, so if they tell you you need to do something, you don't have to hold the phone up to your ear and try and do CPR at the same time. It's not going to work. So put your phone on speaker, let them know patient's age, let them know what's wrong, when you notice what happened, and they'll be there as soon as they can. And more than likely they're going to try and walk you through some of these steps. So the first step was tap and shout. Next one was call 911. Alright, so the next step, you're going to assess airway, breathing, and circulation. It's the ABCs. We were taught that in EMT, you're taught that in CPR. Like I said, if you can find the pulse, don't try and find it any more than 5 seconds. If you can't find it, you can't find it. Check to see if they're breathing. If they're turning blue, that's a good sign that they're not doing well and they need CPR. So this guy, obviously, he's not alive. So what you need to do is, basically the ratio for it is 100 compressions per minute. So we will be doing it's 30 compressions and 2 ventilations. So you want to do it, you want to take the palm of your hand and you want to place it basically about right here. So put the palm of your hand right there, interlock your fingers. Make sure you keep your fingers off of the person. That's just what we've been taught. And then you lock your arms out and you count to yourself so you can keep track of how many you do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now you see what I just did with the ventilations. To properly ventilate, you're gonna want to do it to see the chest rise. If you put too much air in, for example, if you have an infant or a child, their lungs are smaller. So if you put too much air in, you might have what's called distension, which you'll end up getting air into the stomach. You might cause other problems which aren't good for the person. One of the ventilations, you're going to be, what you're going to do is head tilt, chin lift, or what have you. You're going to put your hand on the forehead, tilt back, and open the mouth while closing the nose. So that's proper ventilations. You're going to do this until help arrives, or or they regain consciousness. If they get a pulse back or they start breathing, you stop CPR. The next thing I want to cover is infant and children. This will be pretty fast because I don't have an infant dummy. But basically, with infant CPR, you're going to do the same. You're going to do 30-to-2 ratio, and I think they recently changed that. It used to be different, but with infant, you're going to use 2 fingers. This will be hard for me to do because it's pretty thick here. But you just do 30 of these with 2 fingers, and then the 2 breaths. Because their lungs are smaller, you're going to need to use, a fourth of what your air capacity is with your lungs. All you want to do is watch the chest rise. Once you get 2 done, you continue that. With a child, since they're bigger, same ratio, 30-to-2. Although with a child, depending on their size, some kids are pretty big now, so you might use 1 hand. More than likely, you'll just do the same as an adult and you use 2 hands. The next thing I want to talk about is Heimlich. So let's say you are in a restaurant and a guy 3 booths down from you is sitting alone, he's eating his pasta, and he starts choking. No one's helping him. You notice he's choking. He's got the universal sign for choking. What do? So the first thing you do, you go over to him and you're like, "Are you choking?" He says yes. You're like, "All right, can I help you?" All right. So the next thing would be, you make a fist, put your thumb, find the belly button, put your thumb directly above the belly button, put your other hand over that, and go in and up. Like that. And you're going to do that until the object is dislodged or they become unconscious, and then you're going to have to do CPR. To start out, if you can't get the object dislodged, somebody's going to need to call 911. So definitely call 911, and just remember that the thumb goes above the belly button and you go in and up. If you go straight in, you can damage some organs. So you want to make sure you go up so you can pop that out there. Basically with infant, it's different. You're gonna say this was an infant, Bob, and if he had legs, one leg would be on each side of my arm. With an infant, you're gonna do 5 of these with 2 fingers, and then you're gonna make a V, kind of like Spock in Star Trek, around the face. And you're going to flip over onto your other arm. And you do 5 forceful blows on the back and repeat. 2, 3, 4, 5. 1, 2, 3, 4, 5. If the infant stops, if they can't breathe, after a certain point and they go unconscious, you're going to need to do CPR. Obviously, call 911. And it's a serious matter. Basically, if they are making noise, if you have somebody who's actually making noise, they're not choking. So the best thing they can do is just cough. Sometimes we've been told to, hit somebody on the back when they're choking, and that can actually lodge the object in their throat. So just let them cough. And hopefully they'll be okay. If they don't, you're going to have to perform Heimlich. Special considerations would be somebody who's pregnant and somebody who you can't wrap your arms around. So if I have, say Bob is Bobette and Bob's pregnant, you're going to want to go up in this area. Same principle. Thumb is going to go just about here. So if you got your nipples right here, you're going to go about here, thumb, and same thing. And if it doesn't get dislodged, then you're going to do CPR. But if somebody's pregnant, you obviously you don't want to put any pressure here because you can hurt the baby. So same thing with somebody being obese. If you can't wrap your arms around down here because they're this big, you want to go up to where you can wrap your arms around and go like that. So you just got to remember that you have the knowledge to be able to do this, but you have to feel confident that the stuff you've learned you can successfully do. And just remember, it's not that hard. It's going to be physically demanding, but you have the tools to do it, and it's your responsibility to save somebody's life if you know how to do it. There's no reason to just stand around somebody who's having serious problems. It's either you don't do anything because you're scared and they die, or you do something and they possibly live. So you just got to remember what I've taught you is the 30 compressions and 2 ventilations, and just remember that everyone's life is important. So just use your knowledge, and you should do well with this. So does anybody have any questions?